Hey all, I'm Kara Perez, founder of Bravely Go, and today I want to tell you a story about going to the hospital. When I was 23, I had just graduated college and I had to go to the ER after having 2 days at home of extreme nausea, nonstop vomiting, and extreme abdominal pain. I'm talking, if the pain scale was 1 to 10, my pain was a 25. It was very, very bad. I was extremely dehydrated because I couldn't keep anything down, and I had thrown up so much that my stomach was empty of bile. Like there was nothing in me. So I had to go to the ER. This was the first of 4 visits that I would make to the ER throughout the remainder of 2011. Now, after going to the ER, the doctors put me on a kind of medical journey. I had a colonoscopy, I did fecal testing, I did blood work, I did a lot of tests to try and figure out why I was going to the ER so often. But I never got a diagnosis, at least not in 2011, nor in 2012, or 2013, 14, 15. I didn't get diagnosed until February 2023. 12 years later. Why didn't I get a diagnosis? All those trips to the ER, all of that testing, and nobody was able to figure out what I had. I posit it's because I was a young, seemingly healthy woman. Women face a wild amount of discrimination in the medical industry, and women's pain is often not believed by doctors. And I believe that I experienced that. People didn't think that a young 23-year-old who had been a college athlete, who didn't have extreme weight gain or extreme weight loss, I didn't have any outward signs of being sick. Nobody thought I was really sick. In fact, one doctor told me, after I told him that based on my personal research of my symptoms and what I had been being tested for, I thought I had the disease that, spoiler alert, turns out I do have. He looked me square in the eye and said, "You don't want that disease. It's not a good time." Sir, yeah, I know I don't want this disease, but based on all the things that all these other doctors got me running around doing, and based on the symptoms I'm experiencing, I think I have this disease. Can you take me seriously? And he was like, nah. I was so shocked when he said that to me, but I was like, okay, advocate for yourself, girl, like say something. So I said, I don't want it, but I think I have it. And he literally waved his hand in my face. He went like this. Ugh. Ugh. That's what he did to me. I think about that all the time. I really want to go back to that doctor with my official diagnosis now and slap it on like the glass or slap it on the desk in front of him and have my Goodwill Hunting moment of like, how do you like them apples? I was right, you mother. But I won't. Because I'm a classy lady, and also I now live several states away from that doctor, so it's really not practical. This video is part of our series about American healthcare, how to afford it, how to negotiate medical bills, and how to advocate for yourself in a system that seems determined to not listen to you. If you learn from us, please become a patron. We cannot create this kind of content without our patrons, and patrons get all sorts of bonuses like event discounts, AMAs with me, extra content, and get to help me choose which content to make. You can choose from our $2, $5, or $12 tier. Each comes with their own perks. Find the link to become a patron in our description. Today we're going to be talking about medical gaslighting as well as advocating for yourself. But before we get into it, I do want to put a little bit of a disclaimer on this video. I believe in science. I believe in Western medicine. I believe in Western medication. And I trust that the vast majority of doctors have really good intentions when it comes to their patients. And I know that doctors are also struggling in this bizarre healthcare system that we have here in the United States. Doctors have to go through a lot of education, they take on a lot of debt, and they take on a lot of liability. We're a very litigious country here in the US, and it can be kind of dangerous, professionally speaking, to be a doctor. I don't think that individual doctors are bad people. I do have a lot of trust in doctors, and I think you should as well. I am not anti-doctor, I am not anti-science, and I am not anti-healthcare. I am anti the American healthcare and health insurance industry, which is what we're going to talk about throughout this series. And this series is really to highlight the experience that I've had going through this diagnostic process and to help give others the tools to advocate for themselves and, frankly, to afford healthcare in the first place in the United States. Now, that said, let's dive into medical gaslighting. Medical gaslighting describes a behavior in which a physician or other medical professional dismisses or downplays a patient's physical symptoms or attributes them to something else, such as a psychological condition. That doctor who waved his hand in my face, he medically gaslit me. And this happens every single day to patients of all ages, of all races, of all size, and dealing with all sorts of different healthcare issues. Now, again, this is not an attack on healthcare providers, but we have to talk about medical gaslighting because it's happening to so many people. And in particular, it's happening to women. Women, medical testing, and believing our bodies. Spoiler alert, medicine rarely includes women. And I mean that on every level. From being a part of healthcare studies and medical trials, to even getting treatment, or to becoming healthcare providers, women are deeply absent in medicine. This is particularly egregious to me as Cara Perez because women are the providers of society. Women are the caretakers of society. So for an entire industry built on caretaking and healthcare to not include women is bonkers to me. A 2023 study entitled Lifetime Employment-Related Costs to Women of Providing Family Care finds the amount of time women spend providing essential care to children and adults has a substantial personal economic cost that continues long after the caregiving ends. The estimated employment-related costs for mothers providing unpaid care averages $295,000 over a lifetime, based on the 2021 US dollar value adjusted for inflation. Unpaid family caregiving reduces a mother's lifetime earnings by 15%, which also creates a reduction in retirement income. Women are the ones who are taking care of everyone else. And the fact that our pain, our symptoms, our bodies are not believed or included writ large in healthcare is egregious. Very few people are studying women's bodies. We are commonly excluded from healthcare studies, meaning if they are trialing a new medicine to see, does this help with heart attacks? Does this help with cognitive decline? Women are usually not included in those studies. So we have no idea how those medicines impact women's bodies. This is very dangerous. If we have no idea how a drug will impact a woman, how can we prescribe that drug to women? And this bias impacts all women. Black women, for example, are 3 times more likely than white women to die in childbirth. How can we tell Black women confidently, just go to the hospital and give birth when we have numbers like that? You need to advocate for yourself in a system that ignores you. How to advocate for yourself in a system that ignores you. I know that I'm now a woman who feels stressed about going to healthcare providers because I feel like I need to convince the provider to take me seriously before we can even discuss a plan of action for my healthcare. I literally bring a sheaf of papers with me when I go to the doctor now that has documentation of all of the tests I've had, the procedures I've undergone, with dates and other doctors' feedback so that I can just present it to the doctor because I feel like they will take other doctors' words more seriously than my lived experience. It's bonkers that I have to do this. It's bonkers that in a system that is so expensive and so inefficient, patients must also be their own advocates, but unfortunately that is the reality of healthcare in America right now. I would love to see that change. If you know how to make that change, besides just adopting universal healthcare, please drop it in the comments and let me know what calls I can be making, what letters I can be writing. But in the meantime, I have a few tips for you if you are a woman or anyone who feels that they need to advocate for themselves in this current system. The first tip is to bring documentation. Please be meticulous about the way that you document your own healthcare. So every time you go to a doctor's appointment, ask, and usually they give this to you, a printout of what happened during that doctor's appointment. So if you had blood work taken, if you asked for a certain thing, please make sure that there's documentation of that during the appointment, and you can keep that paperwork with you, put it in your file, put in your file of facts or whatever, and make sure that you have a copy of it. If you are taking medication or you are going through a series of testing, please also on your back end, on your own, put together a documentation of what procedures you're getting, what medicines you're on, and when you start taking them. I personally use a spreadsheet for this, so I have my healthcare costs as well as my healthcare procedures all in a spreadsheet. I have the date, I have what the doctor's feedback was, and I have what happened on that date so that I know, okay, here's my timeline of what I've been through. This is another piece of information you can share with your healthcare team, and it also helps you on the back end keep track of, yes, we've already tried that. No, we haven't tried that. Here's how I reacted to that, etc., etc. Number 2 is to know your patient's rights. There is something known as the patient's bill of rights, and you should familiarize yourself with this before you see a doctor. The patient's bill of rights comes out of Obamacare, or the Affordable Care Act, and it was a collaboration between the Departments of Labor, the Department of the Treasury, and the Department of Health and Human Services. And the Bill of Rights includes things like a patient has the right to respect, dignity, and comfort. A patient has the right, upon request, to be given the name of his or her attending physician, the name of all other physicians participating in his or her care, and the names and functions of other healthcare persons having contact with the patient. It is your medical right to know who's treating you, what you're being treated with, and how you're being treated. Familiarizing yourself with the Patient Bill of Rights is going to give you more understanding of how you can effectively communicate with your healthcare team, as well as how you can effectively stand up for yourself. And my final tip for advocating for yourself in a healthcare system is to be persistent. If you're not getting the care that you want, or you're not getting the type of care in the type of way that you want, please ask your healthcare team to change their approach. If you're being given one drug and you want another drug, you can ask your healthcare team to change that. If you are not being seen on the schedule that you want, you can ask to change providers or to change that schedule. Identifying for yourself how you want to be treated and what you want to be treated with is a step towards advocating for yourself. So that's it for today. Thank you so much for watching. Like I said, this is part of a series, so make sure to hit subscribe so that you get an alert for the next part in our series. Please consider becoming a patron if you learn something from us, and make sure to come back every Monday for new videos.